Good afternoon, everyone. It's 2 o'clock and time to start the media briefing. Joining us on the panel today, we have Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Darren Roush, Health Officer and Director of the Greenfield Health Department. A quick note, Dr. Weston has to leave the briefing at 2:30, so please be sure to get any questions for him into the chat. We'll get to as many of them as we can. Mayor Barrett, we'll start with you.
Thank you very much, Sydney, and I'll roar through this so we can get to Dr. Weston before he has to leave. If you're interested in testing, this is the time to get tested. The wait yesterday was about a 4-minute long from beginning to end. So you can get through American Family Field in literally less time than it takes you probably to watch television commercials. So it was 4 minutes. Yesterday we had 563 people who were tested there. On the northwest side, we had 268. On the south side, 135. And so as you can see, the numbers are down considerably. Anybody looking outside right now can see that the snow has come. So due to not the expected bad weather, but due to the real bad weather, the Milwaukee Health Department will close the American Family COVID-19 testing site at 3 o'clock today, February 4th. The site will also be closed on Saturday, February 6th. However, it is expected to be open tomorrow, February 5th. The health department plans to maintain normal hours for the Northwest and Southside Health Center sites, as well as the Wisconsin Center vaccination efforts. And so let's talk about vaccination efforts because there's a lot of work that's going on right now, and the Milwaukee Health Department continues its great work of vaccinating eligible individuals at the Wisconsin Center. A lot of activity is going on there. Yesterday, a vaccination registration link launched on our city website, which you can find at milwaukee.gov/COVIDvax. And I know when it went live at about 2 o'clock, in 1 minute, we had, I think, well over 200 people at one point who were signing up to get vaccinated. So this is going to be a challenge as we move forward because we all know that there's a limited number of vaccinations that we're receiving. But this is the vaccination site for eligible residents of the city of Milwaukee. So this is for the city of Milwaukee eligible residents. So what we're talking about are people over 65, healthcare providers, people who are involved in law enforcement, first responders, and it's by registration. So if you're an eligible resident of the city of Milwaukee, we encourage you to register to be vaccinated. I would also note, though, that appointments are based on availability of supplies. We anticipated that the slots available would be filled quickly yesterday, and they were. And so I don't want people to be frustrated by continuing to go back to the site every 15 minutes or half hour. But as of right now, the slots have been filled. The commissioner will talk a little bit about what we can do or how we will deal with that. But we have seen the long lines around the country. We don't want to see that here. And we want to make sure we're getting every single vaccination into someone's arm as quickly as we can. But again, looking at the weather, I think you can understand why we do not want to see people standing outside in this weather. So the availability of appointments is dependent upon our availability of vaccine supply from the state. I will also say, if you have a private provider, to work with them as well. I know that there's a number of private providers that are providing the vaccinations right now. There's also certainly the news that we've all seen about next week, Walgreens receiving some. We haven't been able to really nail down exactly how that will work, but we are seeking to work with Walgreens to see how we can get those vaccines into arms of people as quickly and as safely and as efficiently as possible. So once we know how much vaccine is available for next week, more slots will be available on the website. For those without internet access, and this is something I'm very, very cognizant of, that there's going to be a lot of older people who are not internet savvy, who may not have internet, and we want to make sure that they can get an appointment as well. So if you do not have internet access, or for those of you who need assistance with scheduling your appointment, the number is 414-286-8600. I also want to stress once again that in order to be vaccinated at the Wisconsin Center, this is a site for residents or employees of the city of Milwaukee. And the surrounding suburban areas, I would highly recommend that you contact your health department or others to see how you would get vaccinated in those areas. Again, consider contacting your health department or to coordinate a vaccination. In our continuing quest to get more information out as quickly as we possibly can, I will be joining the Milwaukee Health Department to address questions, concerns, and plans regarding COVID-19 vaccinations in a virtual town hall meeting next Wednesday, February 10th at 6 p.m. The town hall panelists will include Health Commissioner Jackson, Chief Medical Officer Dr. Heather Parody of the City of Milwaukee Health Department, Milwaukee Board of Health member Julia Means, a registered nurse at Ascension Health, and we're happy to say that WTMJ's for Tony Atkins will serve as the moderator. The meeting will be aired live with captioning on the city channel, live streamed on Facebook on the MKE Health page, and posted at milwaukee.gov/COVID-vax after the event. To join the meetings, residents should register online. Questions for the panel can be submitted in advance online as well. We think that the town hall is a great opportunity to offer reliable information on COVID-19 vaccinations, and more importantly, to listen to the very real concerns that people want to share. And so, again, we want to get you as much information as we have, as quickly as we have. We're doing this because we believe that our residents should be empowered with the information they need to make the best decisions for themselves and for their family members. We all know that Super Bowl weekend is coming up, and unfortunately, the Packers will not be there. I'm still licking my wounds from a week ago Sunday. Throw the pass on fourth down. That's all I got to say. Throw the pass on fourth down. But that's water over the dam. But we are coming up on Super Bowl weekend, so no matter which team you are cheering for, I want to encourage everyone to practice safe physical distancing behaviors this weekend. Normally, and I'm well aware of this, the Super Bowl is the party day. It's a time to gather for watch parties with family, friends, and neighbors, to share in homemade foods and eat as many calories as you possibly can in a 5-hour period. This year, it's a little different. Consider a virtual watch party. You can still eat a lot of food or stick to watching the game with members of your own household. If you're going to gather with others, please wear a mask, wash your hands, and watch your distance. Finally, I want to encourage the public to ask any questions they have about COVID-19 on my social media channels, hashtag Mayor Barrett on Facebook, and hashtag Mayor of MKE on Twitter. We will work on answering those during our briefing next week. We want to know what you would like to hear about more, whether it's vaccines, new strains of COVID-19, or new information on masking. And with that, a lot of news, but I'll turn it over to County Executive David Crowley to give us a county update. Mr. County Executive.
Thank you so much, Mayor Barrett. And I guess before I get started, I would like to address the elephant in the room as we think about the repeal of the mask mandate that just happened in the State Assembly. And I have to say that it is maddening to see the fact that the state legislature has come together to repeal the mask mandate, yet has not found a way to find for solutions to support local governments, to support local community organizations, to really mitigate this virus. And so for us to be repealing a mask mandate, which is one of the very simple tools that we have in making sure we can stop the spread of COVID-19, is quite mind-boggling. And so I just want to say that, you know that Milwaukee County does not have a health department. And so we're going to be relying on all of our municipal partners throughout Milwaukee County to figure out what they're going to do as it relates to a mask mandate here locally. But also, as we discussed for a few weeks now, we've been discussing the equitable distribution of the COVID-19 vaccination. And I want to share that Milwaukee County House of Corrections has administered the first vaccine to one of our to a resident in our care who is over the age of 65. And there are a limited number of individuals who meet the criteria for eligibility, being age 65 and older and residing in a group setting or long-term care facility. The eligible individuals receive vaccination education from the House of Correction Medical Director, and those who will be receiving the vaccine are receiving it voluntarily. And while we don't have a health department, the county is focusing on groups within our typical purview, so our local health departments and other vaccinators can allocate their resources and time to county residents as they become eligible based on the state's phased rollout. And as the mayor mentioned, this weekend is Super Bowl weekend, and I will be watching the Super Bowl, even though my team, the Packers, aren't in there. And while it may be tempting for everybody to gather to watch the game with friends and family, Now is not the time to ease up on our COVID-19 precautions. Tomorrow marks the 1-year anniversary of the first case of COVID-19 in Wisconsin. And the three W's, remain our best tool against the virus, even during vaccine distribution. So we have to stay vigilant to protect the people around us and continue to wear our mask, wash our hands, and watch our distance. And with that, I'd like to turn it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we've had 95,371 confirmed cases of COVID-19 in our community and 1,019 individuals who've died in Milwaukee County. And now we have 73,082 doses of vaccine given to Milwaukee County residents and 15,486 individuals who are fully vaccinated with 2 doses of vaccine. In our trends, our hospitalizations as well as our deaths are leveling out at about 180 individuals in the county hospitalized on any given day and about 4 dying of COVID each day in the county. Certainly still far more than we would like to see. We continue to have downtrends in positivity and cases, though these are leveling off as well. And with the new strain circulating in the United States and very likely coming to, if not already in Wisconsin, continuing personal precautions of masking, distancing, and avoiding gatherings, as hard as it is during Super Bowl weekend, is so important. We did receive our weekly vaccine update from the state this week. We put it on our dashboard, and several items are particularly relevant. First, we know that the national vaccine supply is extremely tight, though expanding. In the county, we did see a substantial increase in average daily vaccine doses administered from about 2,000 per day on average last week to 3,350 this week. So a 68% increase week over week. And we certainly hope to see similar, if not greater, increases in the weeks to come. Next, we also saw a really nice increase in vaccinations in the 65 plus age group. So in the first 6 weeks or so of vaccine availability, that group had received about 6,000 doses of vaccine. But in just the last week, an additional 14,000 individuals, 65 and older, received the vaccine in Milwaukee County. So that makes for a total of nearly 20,000 individuals, 65 and older in our county who've received at least the first dose. And that's a 340% increase compared to the last week. Hopefully we can ramp that even more upward in the coming week. And this is obviously a key population, the 65 plus, to get vaccinated as soon as we can, given their likelihood for more severe illness. Other age groups saw more modest increases as well. But in particular, we see continued disparities in the race and ethnicity groups that have been vaccinated. So 60% of those vaccinated in the county went to those who are white, which makes up about 50% of our population. But of great concern, less than 8% of our vaccine went to our African American population, which makes up 26% of Milwaukee County residents. And just over 5% of vaccine went to our Hispanic population. That makes up 15% of our population. Both of these numbers are troubling, especially considering that these groups have suffered a very high burden of disease, as seen in cases, hospitalizations, and deaths. These disparities represent a significant equity gap in vaccinations, and one that we are focused and committed to improving. Much of it may be inherent in the initial 1A group of healthcare providers, as well as certainly vaccine hesitancy, which is found to be higher in populations of color. On both those fronts, the county, the city, and the municipalities recognize that as we expand vaccinations to a broader population, we must be cognizant to focus on efforts to reach those who are underserved. Much as we understood testing needs and resource distribution to inform equity through the locally developed SAFER model, we're developing a similar model to understand and evaluate equity in vaccine distribution. So this will greatly assist in decision-making on vaccination sites, population targeting, as well as messaging. We'll continue to work on those fronts and continue to provide updates on efforts and be as transparent as we can with the vaccine data. Now, we all wish that the vaccine rollout could be faster and availability could be broader. I know and have heard from so many people who have spent hours online, on the telephone, trying to figure out how to get vaccinated. And those efforts are so important to enhance the health of our community and help us all get back to some sort of normal. So certainly keep working on getting vaccinated, and we will keep working to advocate for the supply. And certainly as that supply arrives, ensure that we're able to vaccinate those in need as efficiently and safely as possible. Finally, we saw the recent news about the mask mandate being repealed today. We're challenged right now with an urgent and complex timeline. Can we vaccinate enough people to blunt the spread of disease and avoid another spike, especially in the setting of the new variants? One of the most effective, most evidence-based methods of slowing the spread of disease in this critical moment is masking. As we've seen time and again in this pandemic, we now again face a fragmented landscape in our approach. In the absence of broad orders, critical orders, we can at very least do our best to protect ourselves, our neighbors, our communities, and continue to make the individual decision to mask. But even with that, without a doubt, the lack of a broad order will frankly cripple our efforts to contain this virus, to promote health, and to prevent death. Thank you very much. Mask up and stay safe. And I will hand it to Director Rausch.
Very good. Thank you, Dr. Weston. It's my pleasure to join you today. I'm Darren Rausch from the City of Greenfield Health Department. Before we get into the data today, I just want to talk about a few overarching themes that we're seeing in the data. As Dr. Weston mentioned, several key indicators are moving in a favorable direction, and the data I will show you today continues to support a continued decrease. The decrease may have slowed in recent days, but a continued decrease is being seen in our county-wide population. What you'll see when we look at the kid data, though, for those under the age of 18 years of age, we will see a more pronounced decrease amongst suburban children than we do in the city of Milwaukee, and that will be something that we'll want to watch in the coming weeks. And like others, I will mention that while COVID-19 continues to trend in a positive direction, we can't take our foot off the gas just yet. We need to continue to be vigilant and do the things that we can to keep ourselves healthy. So I'll go ahead and share the data here, and we'll get into this a little bit deeper. So what's on the screen right now is the daily number of COVID cases for the entire county. And again, just to orient you, the orange line is City of Milwaukee 7-day average. The blue line is the suburban 7-day average. And we can see really since the spike that happened after the December holidays, we're starting to see a continued decrease in the overall population for both the suburban communities and the City of Milwaukee. However, when we look at the kids report, which I now have put on the screen, we see the similar decrease, but we see a different trajectory. We see it in the suburban community, the rates continue to decrease, whereas in the city of Milwaukee, it kind of plateaus and maybe even increases slightly. So this is something we will want to watch. This would be indicative of more disease occurring in the city of Milwaukee within the last week as compared to the week before, and kind of changes that trend as we've talked about it previously. Going back to our whole county report, if we look at deaths, this is another indicator that we're tracking. We had a big spike of deaths throughout November and December. It looks like that has leveled off, but yet there are still too many deaths related to COVID-19 in our communities. And we know that this is a lagging indicator, and sometimes we'll see that increase in future weeks as we look at those reports. We've looked at transmission rate in the past, and certainly that's something that we trend very carefully. The transmission rate currently in Milwaukee County has kind of inched up to about 0.85. This is a number that we want to keep below 1 because that's indicative of suppressing disease. And we have obviously bounced around up and down above 1 for the last 11 months, but more recently, until the more recent days, we have been well below 1, meaning we're suppressing disease. So again, continue to do everything you can to suppress disease in the community. And we see very similar trends in transmission in both the city of Milwaukee and the suburban communities. When we look at our demographic information, we're still seeing a lot of the same indicators. One of the things we are watching very carefully as we zone in here on race and ethnicity in terms of cases of new disease, is we've seen a very sharp increase among our Asian subpopulation in Milwaukee County. And that population is currently trending, about equal to the American Indian and Alaskan Native line. So we have a lot of cases in the highest rate in our Hispanic population, and our American Indian and Asian populations have now overtaken second place, with our white population in third place in terms of the rate of disease. So we want to watch this carefully because it might be indicative of more transmission in some of our communities. The next data I'll show is related to our testing data. And again, we have said, and you heard Mayor Barrett say before, testing lines are short. Certainly on a day like today with snow, the testing may not be available because of the weather, but certainly we know we have a lot of testing capacity. And really and truly for about the last 6 weeks, we've been trending at about 25,000 tests a week. But I will remind you all that back in late October and early November, we were doing nearly double that number of tests. So the capacity is certainly there. Again, percent positive tests has been decreasing, and the 14-day trend is all very, very favorable. So that's good to hear. Lastly, I'll leave you just with the spatial look at where cases occurred within the last 2 weeks. And this is the map of from January 20th through February 2nd, looking at where cases of disease occurred. And the areas that are red or orange are the areas where we have the highest level of disease in our community. So we can see there's pretty widespread COVID-19 disease throughout the community. So lastly, today, I just want to touch on a couple topics that we've already kind of addressed, both in this media briefing and in others. I want to talk about variants, and I want to talk about vaccine. And certainly you have heard, and we've talked about it here before, that there are new COVID variants. Viruses mutate, and COVID is no exception. And so potentially the variants could be circulating in our backyard now. We're just not aware of it yet because we haven't heard that, but we do know that COVID variants have been discovered in the state of Wisconsin. So while the variants may be concerning, they should not be alarming. And while the variants may be more transmissible and potentially more deadly, I want everyone to remember we have the tools to prevent COVID-19 disease at our disposal, with or without the variants circulating. We know that masks or face coverings work, despite what has just happened in the Wisconsin legislature today. We know that physical distancing and limiting contact with those outside of our households works. We know that increased hand washing, hand hygiene, and sanitation works. And over the last 2 months, we now have a vaccine available to us in Wisconsin as another level of prevention. The vaccine has been proven and effective. And even though the vaccine may differ in its performance related to the variants, the overall performance of that vaccine is expected to be very, very high. So segueing into a talk about vaccine briefly, unfortunately, the adage of eligibility does not equal availability still holds true again this week. The state of Wisconsin is expecting approximately 70,000 doses of vaccine statewide, and they have received requests for over 300,000 doses from community vaccinators like health departments, medical clinics, and pharmacies. That means the demand for vaccine is almost 4.5 times higher than the supply. And that's the reason that weekly vaccine planning is necessary, because of this limited vaccine. And we've gotten some good news this week in the state of Wisconsin. We've heard that there's going to be another 18,000 doses coming to Walgreens that's being shipped by the federal government. This is very exciting, but it certainly doesn't doesn't resolve all of the supply issues we're experiencing, because if we divide these 18,000 doses across all of the Walgreens facilities in the state of Wisconsin, and there's approximately 190, that means there's only about 100 doses coming to each of those Walgreens. So again, I encourage everyone to be patient and cautiously wait until we can get vaccine to you to protect you. Like you, we hope for additional vaccine allocations in the future weeks so we can quickly get vaccine into your arms and add another level of prevention for all of you. Thank you for your time and attention, and I'll now turn the briefing back over to Sydney for the question and answer portion.
Thank you. Our first question comes from Patrick Palantonio at WISN 12. People were able to sign up for a vaccine at the Wisconsin Center hours before the website was scheduled to go live at 2 p.m. yesterday. Why was the portal opened early?
I can take that. So the reason that it was decided a little earlier than 2 o'clock to go live is because as soon as we shared our information as far as availability of the website being open, the City of Milwaukee Health Department experienced around 250 hits per minute to our current website. And so at that level, and also based off of the fact that the schedule was open for this week, meaning Wednesday, Thursday, and Friday and Saturday of this week, understanding we had to get Pfizer vaccine into individuals' arms, we made the decision to open up just a little bit early yesterday.
And I will just say from my perspective, I'd much rather have us have it open early rather than have us open it late. And so this is one of those maybe somewhat unusual situations where the health department was so efficient, it was ready to go a couple hours ahead of time. And I think that, it, again, to ease the overload burden, it was, okay, we're ready to go, let's go.
Being mindful of the time, there are two questions for Dr. Weston. I'm going to ask both of those right now and allow him to answer them and then move on. First question is from Allison Durr. Dr. Weston, when will you have finished the model to better evaluate the equity of vaccine distribution? And then a second question from Rose Schmidt. Can you expand on what the repeal of the mask mandate would mean for our area's ability to curb the spread?
Sure. So for the first question, data is going to be essential to this model, understanding line level data for each person vaccinated, general geography of where people are living. So we are working with the state to get that data. We hope to get it as soon as possible, and we'll certainly get it in aggregate format up on the dashboard to share as well. For the second question, the repeal of the mask mandate and what it would mean. I mean, I think we know that masks are effective in preventing spread. There's a few items that are effective: masking, social distancing, avoiding groups, and getting vaccinated. Getting vaccinated, we have supply constraints. One thing we don't have a supply constraint on is masking. It's something that everybody can do. The health departments, Milwaukee Health Departments hands out masks. You can get masks at your local health departments. So it's something everybody can do. It's about, I think, about as easy a step as you can take to make a major difference in the spread of disease. And certainly when we see the new strains that are circulating that have increased infectivity, increased contagiousness, one of the simplest ways to combat those new strains is do the same thing we've been doing for 10 months. We've unfortunately had to do for 10 months, which is continue to distance and continue to mask.
And I want to stress that with the state legislature's actions, and I concur with everything the county executive said and what Dr. Weston and Director Rausch have said about the inadvisability or the insanity of the actions taken by the legislature. The city of Milwaukee still has in operation our mask ordinance. And so in the city of Milwaukee and in Dane County and other places throughout the state, individuals still must comply with the local ordinances that are in effect. I'll also say, and again, the county executive alluded to this, I understand politics and I understand the fight that they don't want to have the governor have this power. They haven't given a reason as to why we shouldn't have a mask ordinance or a mask requirement in the state of Wisconsin, other than we don't want the governor to have the power to do it. Okay, fine. You don't want the governor to have the power to do it, then you do it. But here we're headed into Super Bowl weekend, and the message that's being sent by our state legislature is, don't worry about the masks. Don't worry about the masks. To me, that's just insanity. It's just insanity to have the legislative body acting that irresponsibly.
Our next question comes from Allison Durr, the Milwaukee Journal Sentinel, for County Executive Crowley and Mayor Barrett. What more do you each plan to do to ensure equity in the vaccine rollout?
Well, Milwaukee County, we continue to support all of our local municipalities as they continue to roll out their vaccine rollouts. But we have to continue to rely on the federal government as it relates to supply. And so it's really hard to say how we're going to get these vaccines in people's arms when we don't know what the supply chain is actually looking like. But we're going to continue to work with the city of Milwaukee and all the local municipalities to support their vaccine distribution plans.
So I actually think there are three issues here. I think there's the first issue, which was the delineation, the rollout, put an emphasis on healthcare workers and gave the initial blast, if you will, to the healthcare systems and others. And there's a disproportionality in terms of the number of people from different races who work for the healthcare systems who live in the city of Milwaukee, where you have the highest incidence of people of color. So I think built into that first distribution, you had things out of whack initially. Second, I think you've got the issues of people being able to connect. And I talked a little bit about internet access and how people can do it, which people have private providers, healthcare providers, because they continue to get a supply. And so if you don't have an internet, if you don't have a healthcare provider, then you're at the mercy of the supply that's coming to your local government, which might be low. We're trying to fight for more here. And then a third one, I think that there is distrust in some parts of the community about vaccinations. And I think there's a historic element to this, the Tuskegee situation, things like that. I think we have to figure out a way to deal with that distrust, because to me, this is a public health issue. And I want people from all parts of this community, to take advantage of this and to get the vaccination. So what we're doing is we're working with our partners at the federal level. Again, we'll work with Walgreens, we'll work with churches, we're working with the county, obviously, to try to get vaccinations to the extent that we have them throughout the entire community. And that's something we're committed to at the city.
Another question from Allison Durr for County Executive Crowley and Mayor Barrett. What are your thoughts on prioritizing doses and potentially setting them aside for zip codes that have seen the most deaths and illness from the virus?
Well, I don't think anything is off the table when it comes down to making sure that we can get a vaccine shot in people's arms. And so, I think that we're going to look at everything that we can, whether that's, working with the city, working with all the municipalities, the state and the federal government, especially when we know how many doses are going to be coming down the pipeline for us to put these vaccines in folks' arms. But I don't think anything is off the table at this moment. We just need to make sure that those who want to get this shot have the ability to get this shot once they're eligible.
And I'll say, both for the county and the city, we're not waiting on this. We are in real time working with the state, working with the federal government, working with other providers to see how we can connect the vaccinations with people throughout the city, because I want to make sure that everybody has the opportunity to get this vaccine. And that's what we are committed to at the city.
It looks like there's currently just one more question in chat. A reminder, if there's any further questions, be sure to pop them into the chat and we'll get to them as quickly as we can. The next question is from Patrick Palantonio at WISN for County Executive Crowley. What role is the county taking with municipalities as they consider what to do on the local level following the repeal of the statewide mask mandate?
Well, we're going to continue to have conversations. I think all of us, no matter where you are, we were looking for the state to step up, in the legislature and make sure that we can have a mask mandate. As Dr. Weston and the mayor alluded to, this is a simple tool that we have to really fight this virus. And so we're going to work with all the local municipalities, the public health officers, to figure out what are the next steps here within Milwaukee County. But we also have to recognize that Milwaukee County is in a very unique position because we are the only county-wide municipality that does not have a health department. So it's going to take us working with all 19 municipalities and 11 public health departments to figure out what are the next steps for all of us.
Another question from Patrick at WISN for Commissioner Jackson and Mayor Barrett. Since yesterday's sign-up period for vaccines opened earlier than initially planned, what is your message to the public as they go online or call the hotline to get their name on the vaccination list?
So first of all, the message for anyone that is attempting to either call us or to go to our website is that understand first and foremost, this is all about availability of the vaccine. So if you go, and we encourage you to go often, if there is not availability of appointments, which is possible because we can only vaccinate how many doses we have. And we know that we don't have enough doses to vaccinate everyone right now in the 65 plus that wants it. So knowing that, we're asking that you continue to go back. If you actually call there is a phone tree, and if you press 5, which is the option for scheduling of vaccines, we can put you on our current list, and that list is constantly going through. It's basically a contact so that we can give you a call back to get you appointments scheduled. So again, understand and know that there are not enough vaccines for everyone today. And so we're just asking that you continue to go back and check.
The next question is from Allison Durr at the Milwaukee Journal Sentinel, also for Commissioner Jackson. Do you know how many calls have come into the hotline for people who want to sign up but didn't go through the website? And also, how many vaccine doses will the city receive total this week, and how many have been requested for next?
Yesterday, we had over 3,000 calls that came into our hotline, which is up from around 200 to 300, which is what our normal volume was. But again, we have staffed up for that. And then as it relates to doses next week, we anticipate that we're going to give out close to 6,000 shots next week.
Are there any further questions from the media at this point? Last call for questions. All right, thanks everyone for joining us today. We will be back here again on Tuesday.
Thank you all.
Thanks, everyone.